Good day, everyone. Welcome to Health Matters by Dr. Fundi. Today, we are going to be tackling a relatively, easy subject. We'll be talking about prescribed medicines that were originally, approved to treat one problem, but somehow, through luck or whatever, serendipity, they end up being used to treat other problems. We'll talk about the story around Viagra, which is something that many men are very happy about. But that was actually not the primary purpose of the drug. So we'll talk about that. We'll also talk about another drug called minoxidil. Also, it's used mainly to address problems of people who lose hair, male pattern baldness, people like me and my co-driver here, but we'll start with the most recent, drug. Others, they call it Mounjaro, but the actual name is called tirzepatide. So on the 8th of November this year, that's about 3 weeks ago, the FDA in the US announced that for the first time, they are approving a medication in an injectable form, tirzepatide or Mounjaro. They were approving this. Other people, they call it Zep-bound. They're approving this medicine to actually be used to deal with the problem of obesity, which is a worldwide problem. But this drug, that was not the primary reason why it came to the market. It came to the market as one of the latest drugs to treat type 2 diabetes, adult onset type of diabetes, where people are either overweight or obese, and they have a problem of processing glucose in their body, and therefore they've got diabetes. Now, this is a big problem worldwide. About 650 million people around the world have got a problem of obesity, where the body mass index is 30 and above. And when one looks at the trend of obesity, in the past 50 years, there's been a 3 times or threefold increase in the number of people who are obese. And many of these people, about 422 million people, are living with type 2 diabetes mellitus. So we're going to be hearing about this Mounjaro or tirzepatide that has just been approved by the FDA for dealing with the problem of obesity, whether a person has diabetes or not. Anyway, it's been used off-label for the past, few months and years. When I say off-label, I mean when you look at the label of the medicine, this was not one of the uses of the medicine. But because of its popularity in reducing weight amongst people with type 2 diabetes, it has now been approved to actually treat obesity. And that is good news for that 650 million people who are struggling with how to reduce weight. But let me also say I'm not alone. I'm with my co-pilot, Mr. Sipho Masiho Tasiga. So Tasiga, welcome.
Hey, Doc. Thank you so much for having me. It's so awesome to be here with you again. Always willing to learn. I'm preparing to be a doctor as well. Not a
Yeah,
fake one, though.
yes, no. And I'm sure when we look at the topics of today,
Yeah.
you will like the one that talks about the blue pill.
Ah, Doc.
But let's start with Mounjaro.
Let's start with Mounjaro.
Yeah.
So, Doc, as you said, that this has been approved. So there's a doctor who wants to tell us all about it. Maybe we can start the conversation with that.
Yeah, let's start it with that.
Okay, cool.
Big news today with tirzepatide, more commonly known as Mounjaro, which is already FDA approved for type 2 diabetes. Well, the big news today, November 8th, is that it's now actually FDA approved for obesity and overweight, and it's now being marketed for that reason under the brand name of Zepbound or Zepbound, Zepbound, Zepbound. And that's great news because what that means is that so many more people are actually going to be able to afford this medication as it's more likely to be covered by insurance plans.
So there you have it, Doc.
Yes. So I mean, if you look at that video, the doctor is actually, excited himself.
Yeah.
He's excited because honestly, as medical people, besides advising people about the diet and exercise as ways of reducing their body weight, we had limited options, like proven limited options. Besides, appetite suppressants and all of that, which come with a lot of side effects.
Yes.
We really didn't have much in terms of prescribed medicines. Other people were even using certain medications, as injectables, like thyroid hormones to try and increase the metabolism, of their patients. But again, those were quite dangerous. So for me to hear that the FDA, which has got very good, researchers, people who are able to prove or disprove claims from some of the pharmaceutical companies. And their aim is to ensure that the public use medicines for what has been proven, which is opposed to, the natural paths where people make claims about this and that, and you find that those claims have not necessarily, been well researched.
Yeah.
So for them to actually approve, Zepbound or Mounjaro, or tirzepatide for use to reduce weight amongst people who are overweight or obese. I think it is excellent news. So for me, I'm actually also quite happy, with that development. And, sometimes patients will just go and use the medicine for what they believe they'll get the benefit. Sometimes even before these are approved. I mean, as early as February this year, in our own country here in South Africa, already there was a big buzz about this Mounjaro. Yes,
Okay.
and it was difficult for people to get their hands on that, because nowadays, in the days of social media, a lot of influential people in the US using TikTok and other platforms, they've been sharing their stories of how much weight loss they have achieved by using Mounjaro off label, because that was not the purpose. But they've been sharing good stories. And so those good stories, everywhere in the globe, people were following these with keen interest. And so even South Africans have been wanting to get this drug. So I hope that now that the FDA has approved it, and South Africa, SAPRA, has got a relationship
With the FDA.
with the FDA.
Okay.
So usually SAPRA doesn't have to go through all of the verification tests before they can approve a medicine. If they are satisfied that FDA has actually done, proper evaluation. We saw that with the COVID vaccines.
Oh, yes.
Those that were approved by the FDA, they didn't take long to be approved here as well. So one just hopes that SAPRA will soon also announce, that these drugs can actually be used here in South Africa for the purposes of reducing obesity and overweightness. But these are not tablets. These are injectables. All right?
Injectables?
Yes.
So it's an injection?
It's an injection, yes.
To
you
where?
get injected, once a week, usually around the thighs, or certain parts around the upper limbs, or around the navel, the fatty areas around there, but it's a once a week kind of dose. You start at about 2.5 milligrams, which is the lowest dose once a week, and you do that for maybe 4 weeks. If it doesn't give you the results, then the doctor can then increase it to 5,
Or increase
to
the dosage.
7.5
Okay.
weekly, all the way up. So it is very important that people know that this is not the kind of drug you're gonna get in the black market and then you administer yourself. It was like all drugs, there are side effects, but the positive thing is that with the positive step by the FDA, it is very likely that our SAPRA will approve it, and therefore more of our people. And I think the bigger thing was obviously when more people are using a drug, the likelihood of the price coming down is much higher.
Okay.
So we're hoping that this approval will mean more people having access to the meds, and therefore the price becoming much more accessible. And also for the health, the health insurance funders or medical schemes to now be much more open, because obesity is now a recognized disease.
A big challenge.
And if there is now a medicine that is approved to deal with obesity, therefore we hope that the approval processes may come quicker, so that more people can have access, especially because there are a lot of problems that come with the challenge of obesity, and so it needs to be dealt with, and it's better if people are able to get proven medicines to try and deal with the challenge, rather than all these other diets that are out there, some of which can actually be dangerous to one's body.
Absolutely. Doc, just one step back, the FDA, who are they? To anyone who doesn't understand what the FDA is and how maybe they function.
I think I'll just simplify by saying this is an agency, an independent agency in the United States of America.
Okay.
An agency that is responsible for the registration of medicines, drugs, and also certain foods, based on the claims that the manufacturers make, and they verify those claims and see if what was claimed is actually in line with the actual experience, and that those things are safe enough to be used. So the issue of safety, the issue of effectiveness become very, very important. So they are a leading regulator when it comes to food and drugs, administration in the US, and many of similar kind of regulators in the rest of the world, they take a cue from these guys. And so if something has been approved by the FDA, then it's likely to be approved by countries, SAPRA in a country like South Africa. Same as CE in Europe, certification by the European, agency that actually does the same. So those are the two leading regulators, of Food and Drugs Administration, across the world. So that's their duty. And now that they have given their thumbs up on the 8th of November, we think many will follow, which will then be good news, because people can get these through proper channels. Because when you deny people access to these things, they will find ways to get these medicines. We saw it with ivermectin.
Oh yes,
during COVID.
Yeah,
a drug that was originally meant to deal with worms, but some people believed that it treats COVID.
yeah.
And even though SAPRA was saying no, even though FDA was saying no, but they believed that it cures COVID-19, and so they found ways to bring it into the country illegally. So the point I'm trying to make is, the sooner it is approved and it is distributed through channels that are legal, the better. The delay will make more people to just bring it into the country illegally, because they are desperate to deal with their challenges relating to being overweight or obese.
Absolutely. I think this is probably, I remember about a few months ago, DJ Spoo's More Fire was also approved by the FDA.
That's a good thing, because then it means he can export it, to the market, in the US as an energy drink, and that will be good news for him. I mean, you've got about 350 million people in the US. So that's that's a big market. And once again, if it's approved there, it's likely to be approved in Europe and other parts of the world. So big ups to him for that.
Absolutely. Doc, you spoke about people that use this as a weight loss. There's a lady who actually uses it.
Wow.
And I want us to listen to what she has to say.
Let's listen.
Okay.
Of last year, I started taking Mounjaro to help with weight loss and PCOS and insulin resistant and a slew of other things, which means today is my 6-month anniversary. In honor of 6 months, I thought I would share 6 things about Mounjaro that have completely changed my life. Number 1, the first side effect I noticed almost immediately within hours of taking my first shot was the food noise. I used to wake up in the morning and think about, like, what am I going to eat today? When am I going to eat? What's going to be for lunch? What's going to be for dinner? I thought everybody lived that way. I thought I was a foodie. No, that food noise is not normal for most people. In turn, it caused a lot of my binge eating problems. The second side effect that I noticed pretty quickly was a reduction in inflammation and joint pain. So I was somebody that was suffering with chronic, joint pain and inflammation. I started feeling that reduction in joint pain and inflammation in about a day. Number 3, pretty quickly, I noticed an increase in more energy, feeling more alert, feeling more awake, feeling better overall. I just had more energy. I was wanting to do things like actually work out or to just go for a walk or to see friends, things that I wasn't doing as much before, which kind of ties into number 4, my mental health. I'm struggling with a lot of depression and anxiety. And since I started taking Mounjaro, I have felt better mentally than I have felt in years and years and years. Number 5, you can see these all tying together, but number 5 is sleep quality. I started sleeping better. I actually canceled my second sleep study to talk about my sleep apnea because I stopped snoring and I started sleeping so much better quickly after taking Mounjaro. And the last one, number 6, although this is the reason I started taking Mounjaro, it is not the most important one for me, and that would be weight loss. Since starting Mounjaro on October 9th, I've lost 56 pounds. So happy 6 months to me.
There you have it, Doc.
That's a very, very happy, I'll call her a patient.
Yes.
Very happy patient. I mean, she says she lost 56 pounds. Now, the current thinking when it comes to type 2 diabetes, there are standards that were released by the American Diabetes Association, what they call standards of care in diabetes management.
Yeah.
One of the things that they said is that central to the treatment of type 2 diabetes must be weight loss, at least 15% weight loss as a way to deal, with diabetes. And so you now have a drug like Mounjaro that will help with the diabetes, treatment in terms of the control of the sugar or glucose in the blood system. But as an added benefit, people are losing weight, and it is able to achieve that 15% weight loss amongst people who have got type 2 diabetes. So this lady was telling us that she sleeps better.
Yeah.
She now has less of appetite. She's got tons of energy. The inflammation from joint pains has gone down. And, she says she used to suffer, or she is suffering from PCOS. I'm not going to go deep into that, but it's polycystic ovarian syndrome, where the ovaries have got a challenge of multiple cysts, and these people tend to have a challenge with, excessive weight, and therefore the insulin, even though they can still produce it, but it is unable to actually work where it's supposed to work. So meaning there's a resistance to the insulin attaching and allowing for sugar to go inside the cells. So that's what this lady is suffering from. And she says she has just finished 6 months on Mounjaro, and she can only have praises, for that. And so I think that's the thing that is making people now to want to have access to this. But I think they must also be careful because the black market is there.
Yeah.
And there's no guarantee that what you will get in the black market will actually be the real thing. So I think it's important that we have the regulation, the approvals, and get these things through proper, channels, either your own doctor or from the pharmacist.
Are there any side effects to Mounjaro?
Well, like all pharmaceutical medicines, there will always be side effects.
Yeah.
So nausea, diarrhea, decreased appetite, but that's what you want. Constipation, indigestion, and stomach pain are some of the side effects. But obviously, when we give one medicines, we are looking at what we call the benefits must outweigh the side effects. So, but in any medicine, they must always list the potential side effects, so that there's nothing hidden. And then the doctor and the patient must then weigh those side effects versus the benefits of using that particular meds. And as long as the benefits are outweighing the downside in terms of side effects and adverse effects, then it's all good.
Makes sense, Doc. So I think you did say that do you need a prescription for this? You need to see a medical doctor for this?
I think because it's an injection. In South Africa, HPCSA gives guidance in terms of who can do certain things, who can draw blood, who can inject, all of that. But anyway, for me, I think it is best that those injections are done under the guidance of a treating doctor. Obviously, people who are diabetic, they inject themselves on a daily basis, but they get trained by a diabetic or diabetes nurse who normally works with the doctor on how to give the injection, so that, it is effective. So I would say people who are going to use this, they must do it under the guidance of their medical doctors, their diabetic nurses, or their pharmacists. And be aware also that there can be side effects. This is originally a tablet that is supposed to reduce blood sugar. So sometimes if the dose is high, there is a potential that it may actually reduce the blood sugar to lower levels, what we call hypoglycemia. So I think it is safe for people to use this with caution and, under the support and guidance of their treating doctor.
Is there a possibility of abuse on the part of the patient?
Well, there's always a possibility of abuse. I mean, people are desperate to lose weight out there. And somebody may okay, actually 2.5 is working, but why don't I just double it? And so you find that middle of the month, the treatment is finished because they have, without the guidance of their doctor, doubled the dose. And then they go to another doctor to get another prescription. So possibility of abuse will always be there, but I think people must just take it easy. It's normally 4 weeks on the same dose before a doctor can then say, okay, maybe let's double your dose and see what happens. Yeah.
Absolutely. Doc, there's another one that you were talking about now. It's minoxidil. I'm interested to hear how that was an accidental, all these accidental drugs.
Yes. So, we've just been talking about Mounjaro, which was, one of the newer groups of diabetes treatment, what we call GLP-1s, the newer drugs to treat diabetes, but it has now been found that it has got this good side effect of weight loss, and so it's now been approved to actually get people to lose weight. But that's not the first time, in the history of medicine. It's not the first time that a drug that was developed for something else ends up being used for another. So there is a drug that is called minoxidil. A drug that's called minoxidil. So that drug, minoxidil, was actually developed by a company called Upjohn in the late 50s for the treatment of ulcers, peptic ulcers. But the scientists there were not so happy that the treatment did not do what it was supposed to do, which is to cure ulcers. But they actually found that this drug had an effect of widening the blood vessels, the arteries and the capillaries, what is called vasodilation. And, so from 1979, this drug then got to be used to treat high blood pressure.
Okay.
Yeah, because it was able to open up the vessels and reduce the pressure. But then the people who were using this drug for high blood pressure, they started, reporting that they've got a lot of hair growth in their scalps. And so that was a side effect to a treatment for high blood. All right?
Yeah.
But then in the 1980s, especially 1988, the year before I qualified as a doctor, minoxidil then got to be approved for the treatment of hair loss. So now it became more like a spray that you spray, in the part where you're losing the hair.
Yeah.
And that stimulates growth. Now I've got a personal story about this.
Okay.
I'm one of those guys, already by around 25, 26, I was losing my hair.
Bandlan.
Yes.
Okay.
Yeah, and at that time you don't want to be a bandlana.
Yeah.
I've got a friend, I won't mention his name.
Okay.
But this guy, we were at medical school together.
Yeah.
He was a class ahead of me. So this guy, that weekend, starting on Friday, Ukenya a cap.
Okay.
Yeah, because we used to groove a lot. I was a groovist, gentleman. I was a groovist. So Fridays, the books on the side. Kinda lady party,
Yeah.
you know, and libanyana. So Friday, Saturday, kiddie party. So we were staying at a place called Alan Taylor Residence, just outside of Durban, because black people couldn't stay at the main campus because we're black.
Yes.
So we were staying at these World War II barracks next to the oil refinery there in Durban. But although it was a lousy place, but the social life was tops.
Yeah.
Parties, busy parties omhlaba, like we had good parties. And, Bella, you're going to be doctors. Yeah? So attracting girls from Forte, from WOP, from Unizoom, from,
Yeah.
So, Kadi weekend, there's always some nice people there, coming. So this gentleman would put a cap so that when the young ones or the ladies come, and he will only remove the cap after round 1 or 2.
I'm thinking
After win, then at that time, even if it's already too late.
or like
Exactly. So, but that was before minoxidil was approved for hair loss, So, but for me, in my 25, 26, I started seeing that I'm losing hair, and I tried to use minoxidil as a spray, but I think I was too late.
Did it start losing from the front or from the...
Yeah, no, it's just, when you look at me from the top, you would see that it was sparse.
KFNB.
There's less hair.
Yeah.
But if you shave from the front, you can see the hair, but if you come from this side, there was trouble. I was like, if I can just delay this thing until 35, then maybe kitloba sharp.
Yeah.
By age 30, I had to do Chiscop.
Yeah. Why?
Yes. I mean, there were even those sprays that were being advertised on TV. They're like black. You spray and you are just kind of dying.
Did you try that?
Hey, try everything before Kishapa Chiscop full time.
Yeah.
I tried everything. So this minoxidil was still new those days. I think this is around 93, 94. And I tried it, but I think it was too late. So since then, I've been Mutua Chiscop.
Wow.
Thanks God, Chiscop is fashionable.
It's an
and it never gets out of fashion. Otherwise, the only thing that I have to do now is hair transplant, but for now, Kishap Chiscop. Yeah.
Sure.
Maybe it will not respond someone.
Hey, dog, it goes all the way up.
So you're not one of those guys who only remove the cap after action.
No, I can't walk around Kampala. And FNP. So
yes,
like,
so there's this I know we're talking about minoxidil, but there's this friend of mine who always says to me, hey, Fundil, when you go to the salon, they must give you a discount. Because, already there's like 30-40% of your head that doesn't have hair. So they shouldn't be charging you the full fee, because God has already done the work for them.
40% discount.
Exactly. But anyway, back to our topic. So Ribulela, we're speaking about minoxidil. So minoxidil was eventually approved for hair loss in 1988. But that was not the original plan of the company that actually started doing this, in the 50s and even in 1979 for hypertension. But so that's a second example of a side effect being used, to now treat a certain problem, which was not the primary problem. So Mounjaro and its approval for weight loss, it's not anything new, because we've seen it. FDA, the very FDA, approved minoxidil for hair loss treatment. So yeah, and so this is the second drug. I mean, there's many of them, like Valium, what we call diazepam, which people use a lot, for anxiety and to induce sleep. Also it was found by mistake, just like penicillin. Penicillin was found by mistake. When some fungus accidentally fell into a petri dish that has got the germs, the Staph aureus, and it killed that Staph aureus, and then that's when they knew that, this thing can actually be used to treat. That was in 1928. So there are situations where things happen by luck, and yet that luck become the biggest thing for that company, because minoxidil is being used a lot. When you look at the demand for Mounjaro, it's gonna be a big winner for the company that produces this. I think it's Eli Lilly, but yeah. So it's not. The other one that we're gonna be talking about is Viagra.
I think we'll get to that. There's a lady who's using minoxidil, Doc.
Yeah.
I just want to play this video so that we hear what she has to say.
Lovely.
All right, let's do this.
The minoxidil I'm using is this East Moon. I'm using it to grow back my hairs, and I like the fact that it comes with this little dropper. My hairline has just been struggling, guys, for years, and quite frankly, I'm tired. So I just use it to grow my hair. And yes, I know they say, after you use minoxidil, like, don't stop using it, otherwise your hair will fall out. Hey, guys, now I'm here now, and it's growing nicely. Shame, it's just that my hair, the texture looks very weird. Like, as you can see, yeah, it doesn't look like my 4C. But whatever, we'll see when it's grown out. But yeah, this East Moon one.
You see now. These things we call that trauma alopecia,
Trauma alopecia.
Yes, well, it's an alopecia, loss of hair as a result of trauma to the scalp, because they put glues, to put their weaves and whatever. And sometimes those who are using braiding, they pull the skin too tight. So over time, banally ribita njibaba kaskos.
Njibaba.
Yeah, njibaba and jips. The loss of hair on the front part. And you find, you see ladies now where the weave starts actually in the middle of the head. Which is because slowly they go backwards and backwards and backwards, because they've traumatized the scalp, and then the hair follicles are damaged, and therefore there's no hair growth. But anyway, that is not the point here. But if you could look at that video, the lady is actually having hair growing back in the area where there was no hair, thanks to minoxidil, a side effect of an antihypertensive drug that was never meant to be a hair loss drug.
Absolutely. You don't need a prescription for this one.
Look, I think nowadays you don't, but I need to check that. You know, in the early days, you needed a prescription from a doctor. It was a Schedule 4 kind of thingy. But sometimes, they reduce the schedule to like 2, and then you get it over the counter. So I'm not 100% sure. Let me just say I'm not 100% sure. Okay. But it's likely that it's not as tightly controlled now as it used to be in the past.
Doc, we're about to talk about my next favorite tablet, the Viagra. Can I play the video first and then we wrap up the conversation
Please.
with just your thoughts on it? Okay.
That's right.
Let's go.
Did you know that one of the most successful products of the century was actually discovered by accident? So the pill Viagra, yes, the one that everybody knows about because you see commercials for it all the time, did $1 billion in revenue in less than 2 years. But it was actually this close to getting dropped by the company because it wasn't doing what it was supposed to. So back in 1989, they were doing trials to figure out if they could find a solution to high blood pressure and chest pain. And so they started testing it on a group of men like they usually do, and it actually all completely failed. And it looked like the project was going to be completely scratched until the nurses noticed something weird. So during the trials, all the guys were laying on their stomach, and you can probably guess why. So they reported this strange side effect that kept happening, and the scientists figured out they were onto something. So within 3 months of their launch, Viagra did 1 million prescriptions, and it did $1 billion in revenue in less than 2 years. And not surprisingly, today this has reached tens of millions of people. So what's the lesson here? Sometimes in your business, you're trying to find a solution to problem A, and what you end up with is discovering a solution to a different problem altogether. But that solution could actually be your next big thing. So as long as you are in the game and you are improving what you are doing, you are that much closer to your next discovery.
There you have it, Doc. Interesting discovery.
Yeah, no, very, very interesting discovery. Those guys who were part of that study must have been very happy. They must have been happy, I mean, they were testing drugs, for high blood pressure and also, to deal with angina, which is the heart pain when you have a heart attack, you know. I mean, these guys, they had a very interesting side effect, that of getting strong erections. Yeah, very, very strong erections. Viva! Very, very strong erections, and it was happening to all of them.
But now, Doc, sorry, before, these guys were laying on their stomachs.
Yeah.
And then they're getting like an erection. So I know if a movie sees
so that's how they found this blue pill, Viagra. So the chemical name for Viagra is actually sildenafil. Sildenafil, that's like the generic name, but it's sold under the name Viagra, which is a trade name. So I mean, this drug was not necessarily doing what it was supposed to do to dilate the vessels of the heart. But the male test subjects were very happy. Because of the erections. You see, erection is to get it up and have a sustained erection. Yeah? Not only to get it up.
to last you.
It lasts you, you know.
It must do the job.
It must do the job. And so it's been the latest, one of the biggest blockbuster medicines of all times because the demand is high. You know, and even further, other companies now, they started investigating this class of drugs, that sildenafil, stays in. I'm sorry, that it belongs in. And so there are other drugs now that are in the same field, like tadalafil, what we call Cialis. Some friends of mine, they call it Cia. Some friends of mine, they call it Cia. You say, look, so Cialis is in the same class as Viagra. But its advantage is that its effect is prolonged. So
meaning what, Doc?
For it can be active in your blood for about 36 hours. Right? I'm not saying 36 hours only erection. No.
I was like,
no. But what I'm saying is that whenever you want action, utorifela nje.
Oh,
Ya
ebere. Oh, wow. Ukare ke noga.
You know, whilst the other one, within 24 hours, there's less of it in the blood. You need to take another one. But Cialis, just one. So they normally sell it in twos or in fours or in sixes, you know.
It's tablets.
It's tablets.
Okay.
You take it about 15 to 30 minutes before action.
Oh.
You know.
It's a pause.
So I know of some guy who took it hoping and then so the guy so usetse one.
Oh my God.
Viva the whole night. So
hey, that's the worst pain for any man.
So I think what we're trying to say is that some drugs that were developed for another purpose, they end up being very good and popular. So the company that produces Viagra, I mean, they've made tons of money from this. They've made tons and tons of money from this, and so. But we can go on and on talking about drugs that were produced for something else that end up being used for something else. So what's the moral of the story?
Yeah.
The moral of the story. I mean, we spoke about Mounjaro, we spoke about minoxidil, we touched about penicillin, we touched a bit about Valium, but the moral of the story is that in science, just like in life, luck does play a role. Without a bit of good fortune, many of these revolutionary medicines would not have existed. Yeah. I'm sure you can agree with me that Viagra is revolutionary.
Well, if I was a
Viva
user.
comrade. Viva comrade,
Yeah.
So I think it's important that when you are up to something and you are researching something or working on whatever, you keep going, because you never know. You may not achieve your primary objective, but actually the secondary objective, in fact, it was not even an objective, but you may just hit, some gold, and then you smile all the way to the bank, and in the case of Viagra, you smile all the way to the bedroom.
Yeah. But Doc, I wanted to ask you on the part of men's erectile dysfunctions.
Yeah, it is. Yeah.
Okay. So what is the primary cause of men need a Viagra? What is it? Is it an age thing, or is it an obesity thing, or is it what is it?
I mean, it's many. It's many things.
Okay.
It's many things. I mean, the easy example is that those people who have got diabetes, right, type 1 or type 2, one of the complications of diabetes is what we call microvascular complications and macrovascular complications. So one of the microvascular, because when you are aroused, the body tells the blood vessels there that, you know what, can you open
the pipes?
Can you open the blood vessels so that more blood can flow into those spongy things that are part of the penis so that it can be erect? You see? So those spongy things, they need a rush of blood to go in there so that you have your Viva.
Yeah.
Right? But now, if there is a problem that the capillaries that are bringing blood there are a bit blocked because of the diabetes that is not under control, then the person doesn't get enough blood going in to make that spongy thing strong
Okay.
and full.
Yeah.
And therefore, you find that you're struggling to get an erection. More wabat, right?
Okay. The mind is strong, but
the mind wants,
yeah.
but the blood is not flowing enough
Yeah.
to the equipment. You see?
Yeah.
And so therefore, the erection is not there. Or if you manage the erection,
Yeah.
if you like a speed, 2-minute noodle nyan.
Oh, doc.
Yeah. So therefore, such people, there's a medical reason
Okay.
for not being able to either have an erection or maintain an erection. But also, with a bit of age, from 40s onwards, the arteries or the capillaries that take blood in there are not always very, very open, like when you were in Fico's age, as an adolescent and a early 20s kind of adult.
Yeah.
That's why they can go for 8 rounds. They can go for 8 rounds. Once he gets an erection and then he waits for 5 minutes, another erection.
Yeah.
A man of my age, 40 and above, there must be adequate time between before you think that you can ask for a second round.
Yeah. Interval.
Exactly. So, but I think the other thing that's important is that the biggest sex organ is the brain. All right?
Really?
Yes.
Because it starts there first.
It starts there.
Okay.
So if there is something that is disturbing you at a psychological level, you are unlikely to have, an erection or a strong, sustainable erection. So at times when somebody comes and they are coming with that challenge, part of what I have to do as a family physician is to also ask about, a lot of things, in terms of their mental state and all of that. Maybe stress is or there are challenges, financial issues and whatever. So when you are having a lot of stress, then you may not be able. So the solution is not a Viagra.
Okay.
You see, the solution there is to get therapy to be assisted with whatever that is challenging you, rather than, thinking that I must just get the Viagra, all will be sorted. You sort out the mind first. So that's why part of the symptoms of depression, major depression, is actually a reduced sexual desire, but also, you might find that you've got challenges with weak erections.
Okay.
Yeah.
And then Viagra, do you buy it over the counter or do you need a prescription?
In the South African context, you're supposed to get a prescription from your doctor because remember, it's a medicine.
Okay.
Like all medicines have got side effects. Yeah. But, there's a serious black market out there for these tablets, and, people love them. And it's difficult, but I think it's a good thing to get it from the proper sources and not get it from the. I can see that you haven't used these tablets, Tasiga.
No. Thankfully not.
Well, so there's this friend, there's this other friend, there's this other friend. He did get, Sia.
Okay.
He did get Sia.
Okay.
Cialis.
Yeah.
And he was going for a derby game. A derby match, a Chiefs the Pirates.
Yeah.
Where losing is no option. So he knew that the game that he was going for, couldn't fail.
Okay.
And we assisted somehow.
Okay. What with Sia?
with Sia.
Okay.
Yeah. And, the feedback he gave was that, he was told, you are a god of this thing. I've never had multiple orgasms. So that guy kept the message for months.
Yeah.
He was like, hey, what?
Yeah. Can I evidence? Yeah. Oh, wow.
But anyway, on that note...
Wait, Doc, before you close, I just wanted to ask you this. So, Sia, you also recommended after a consultation with a
No, I mean, they're all in the same class.
Okay.
So doctors should prescribe these because, again, Sia, I call it Sia, but I mean, Cialis is actually in the same class as Viagra. It needs to be prescribed by a doctor. But like I said, there's a big black market out there.
Absolutely.
So, but if you do you get to the black market, make sure you get the right product, because some of the products may not be the real thing, or the dosages may be wrong, and you may have a problem. There's something that we call priapism.
Priapism. Okay.
Yeah, priapism, where you have an erection that does not stop.
What?
Yeah, an erection. You've overstimulated yourself, with the tablet. So now, it becomes a medical emergency. Sometimes they have to pull, drain, the blood from your equipment,
What?
Yes.
Can you, like, sort of like an injection?
The needles there, because now you've over. So the point is, when you take some of these medicines and you don't know the source, you don't know how well the production, you may have a situation where there's overdose, and that overdose can create problems for you. Yeah.
And then there's Mpesu. Is it Mpesu? Does that work? Or
How? I should be asking you, comrade.
No, like I don't have that challenge.
No.
Not yet,
I'm not saying, but remember, you are an activist.
Yes, I am.
And you've attended a few of the conferences of the big movement.
I wouldn't know.
No.
I see where you're going.
No, you don't need to have participated.
Okay.
When you go into these conferences, there will be all of these people who are selling others. They're selling regalia and whatever.
Yeah.
But in a conference, it normally takes about 3 or 4 days or something like that.
That's true.
There are people who are selling bottles of mpesu or powder ya mpesu, and they will write it there. Yes. And because during the conference, after the deliberations, other things do happen.
Yeah.
And Mpesu does facilitate, that. So the guys from Limpopo, they swear,
they swear
on Mpesu, and actually, I think what we should be seeing, we should be seeing more research on the Mpesu to find the actual active ingredient there that can then be extracted and used as a tablet. That's what is needed. Because some of these mixtures, the dosages are not the same, and you run a risk of overstimulating yourself and having priapism, which is a medical emergency. Can you imagine? You went to a conference to deliberate about matters of national importance. The next minute, report high, because you had an erection that could not stop, and the question, Exactly. So I think the moral of the story is, let's be careful about what we consume. As mixtures, what do you call it now in Zulu?
What do you beat? So what
Yeah,
people
imbiza. Yeah, imbiza, or the powders that are sold there. But next time, when is the next conference?
Hey, the next conference after elections, Doc, 2025.
Okay. But anyway, so
province
I'm making you aware for the next time kunali conference, ushebe the suppliers there.
Yeah.
Hey,
But Isanda.
Mbesu is one of the highest selling products there. Yeah, you know, second to the t-shirts.
Yes. Okay.
Exactly. So as a comrade, I'm just making you aware that you know, there are other things that happen there in the conference.
No, definitely. Kita ba check ma comrade ana kere ke mangwe no le nguseng o satsana le priapism.
Exactly. Yeah. But anyway, no man. This topic was really supposed to be a light-hearted take on developments in the medical space, developments that sometimes are not planned, but they actually become beneficial, you know, to consumers.
Absolutely. Yeah. Doc, we've come to the end of the show, so I think any wrap up, because I think you've just wrapped it up. But you've got something else?
I don't think I need to add anything. I can see that our friend BE is very, very interested. He was listening attentively as we're talking Viagra. Lisia.
Yeah.
So I pity, you know, whoever
Otokopa prescription after the show.
Prescription, yeah.
All right,
no.
Thank you very
finish,
much, Doc.
It's
been a great conversation, Doc. Thank you very much for empowering us and educating us about these matters.
Yes, no man. Good December, boss. Good December, boss. So we must empower people above and below. Yeah.
Go beyond. Thank you, Doc.
Sharp.
Hola.